Hello, friends. Hope all of you are safe and sound. This is more than 3 weeks in lockdown. All of you must be staying home, staying safe, taking all the precautions. I hope you are being very careful. You have staying at home most of the times, not stepping out. Keep washing your hands, maintain social distance, and if you are going out to buy some essential items, then keep in mind that you have to maintain that distance at grocery stores or any other place where you go for your essentials. It's extremely important. A few more weeks we have to take that precautions, and I expect you to continue maintaining these good habits which you inculcated during this period of lockdown even much longer, so that we continue to be safe and healthy. This is by taking all these precautions, not just you keep yourself safe, but you are helping your community, your family also. So today's Facebook Live is about body contouring. When I say body contouring, my idea is not just to speak about liposuction or any one particular procedure. Body contouring is a wide range of procedures, and it's not just about liposuction. So, personally speaking, I consider that surgical intervention, which as cosmetic surgeons we do, doesn't provide complete solution, and body contouring has to be seen in larger perspective of weight loss, and body contouring needs to be seen in a larger perspective of weight loss also, and healthy lifestyle as such. So, and other thing which many of you get confused about is that as if body contouring as a cosmetic procedure is only domain of rich and famous, or people who are associated with some kind of show business, or celebrities, or extremely high profile social life. Only those will need it. But my experience is everybody desires to look good, and there is no restriction, or there's no limitation on asking for perfectly contoured body, and it adds a lot to your confidence and your self image. So I will briefly explain you what exactly we mean by body contouring in cosmetic surgery. So there are three components to it. Number one, you should be close to your ideal body weight. So at Iconique, I always suggest healthy change in your lifestyle, and you must make positive change in your dietary habits and into your lifestyle. You should be more active, and you should try to approach your ideal weight by bringing about positive change in your life. That is extremely important if you want to see good results over the years. Second part where we come in specifically with our surgical skill is removing the fat and tightening the skin. So these are two components where we play a direct role. And third is keeping you motivated to stay in great shape. So we are the only one in industry, and maybe the only practice wherein we focus at long-term solution, and we help you stay motivated for a very long period of time, even post procedure, so that you continue to stay in good shape and it becomes part of your life and second nature. So there are two components as far as surgical component is concerned. One is removal of fat, that's liposuction, and other is tightening of skin. Now, removal of fat is done by injecting small or large amounts of particular liquid, which is mixed with a little bit of anesthetic and another special drugs. So this mixture of normal saline or ringer lactate, a particular kind of solution, is injected under the skin. It makes your fat loose, and it almost eliminates the potential blood loss. So after doing this, we take out fat from your different parts of the body from under the skin by making very small holes, which are generally 3 to 4 millimeter in size. and usually do not need any stitch for that. And we take out these, insert small cannulas into these holes and take out fat which has already been loosened and softened by the fluid which we had injected earlier. So this procedure generally takes around 2 hours, 1.5 hours. It can take even longer depending on how much areas we are dealing with. This is mostly done under general anesthesia. If you're doing targeting multiple parts or larger volume, and if you're looking at very small volume, then we can do it under local anesthesia also. But whatever we do, most of the times we end up sending you home same evening or maximum next morning. Now, who can actually go for body contouring procedure? There are two reasons to go for body contouring procedure. One, you are almost close to your normal body weight or maybe little above that, but you're not grossly overweight. So do not look at body contouring as a weight loss solution. So neither you should look at it as a shortcut or as a replacement to bringing about positive change in your lifestyle. Body contouring procedures do not replace good dietary habits or good active lifestyle. You must exercise and you must maintain healthy dietary habits. Body contouring procedures are not going to replace that. And if you are close to your ideal body weight and you have areas which bother you cosmetically, and whether you find that it's very difficult to lose fat even after continuous exercise and taking all dietary precautions, you can go for liposuction. Now, which areas can we target? Virtually any body part, almost any body part can be targeted by body contouring procedure, whether it's double chin or cheek fat, chest in case of men, belly fat, love handles, flanks, back, arms, thighs, even calves, buttocks. Any body part can be targeted. And in case of women, even breast can be reduced in size or reduced in bulk by doing body contouring procedure, which is almost scarless procedure. So what exactly happens to the fat which we take out? Many of you keep wondering, and how much fat we leave behind. So whatever fat is taken out in body contouring procedure is taken out of your body from under the skin and it's discarded. It's gone forever. This particular fat can never come back. So those fat cells are lost forever from your body. So, but it doesn't mean that we take out every single cell of fat or every single gram of fat from under your skin. We never do that. Skin needs some fat under it to maintain its shape and contour. So our experience lies in that we do feather touch contouring, and we only give you contours and our best effort is to give you very soft contour and not to take out too much fat. So this is extremely important that you never insist on taking out too much fat from under the skin. It can give very awkward appearance. We leave thin layer of fat behind under the skin, which maintains its shape and smoothness. Now, the other thing which is important and which you should know is these days we can utilize this fat to improve your contour further. I mean, particularly for high definition liposuction, or commonly known as 6-pack or 8-pack liposuction, or say hourglass figure for women, and for augmentation or enhancement of breast or buttocks. In case of women, we can make use of this fat. So this procedure can work two ways. We can take out the fat from areas where it's not desired and inject it back after processing it into areas where we need some kind of enhancement or augmentation. So some of the fat which we need, we can inject it back. Rest of the fat is discarded. Now, other thing which most of you want to know is whether these results are long-term and how long these results are going to last. Whatever fat cells or whatever fat is taken out is gone forever. it never comes back. So does it mean that we're never going to put on fat in those particular areas where we have taken out fat? Now, not exactly. Mostly, yes, you're not going to put more fat in that area for many, many years to come. But this is not true all the time. So what is the caveat or rider here? So what we have to understand is that since we leave a thin layer of fat behind, and if you do not bring about a good change, or you continue to gain weight over next few years and months, those particular fat cells can increase in size, and some of the benefits can be lost. So it is extremely important that for you to maintain a good and healthy lifestyle. So another question which many of you have been asking: how painful is this? During the post-operative period, post-surgery, you will be on painkillers for 7 to 8 days, and uh, there can be some discomfort. You can feel some little bit of pain, and particularly on movement. We do not want you to have excessive or strenuous activity during first 2 to 3 weeks. Although you can move around and you can do your routine stuff most of the times after 2 days. And medication is only for 7 to 8 days, which includes antibiotics and painkillers. So recovery period, I will say you need a day in a hospital, another 2 days at home, and after that you can resume your normal non-stressful activities. And by around 2 weeks, you should be back to your almost normal activities or routines. How long this procedure takes? The procedure takes around 1.5 to 2 hours, and if you're targeting multiple areas, we can extend this procedure up to 4 hours, sometimes even more than that, if it's combined with tummy tuck procedure or some other procedure like breast lift or breast reduction. Are there any scars post procedure? So body contouring procedure has two components, as I told you. One is liposuction or removal of fat. So this procedure is virtually scarless. We do not leave behind any scars. We make very small holes which heal with almost invisible scars. So these holes are just 4 millimeter in diameter, and we most of the times we do not need to even put a stitch there. So as far as removal of fat is considered, it doesn't leave behind any obvious scar. Now, many patients, particularly women who are middle age and who are post pregnancy, they have a lot of loose skin, and sometimes we need to tighten the skin. So if we combine tightening of skin procedure along with the removal of fat procedure, which is known as tummy tuck procedure, which again can be mini tuck or full tuck, depending on how much skin is lax. So in that case, there is a linear scar. There's a long line of scar, which is very low on your stomach and is normally hidden in your undergarments. So there can be a small scar, but in cosmetic surgery, we are trained to put scar very nicely, and our scars are very fine and narrow, and they're not like scars which are wide and ugly. And moreover, we have expertise, and we try to guide you further in post-operative period so that these scars are lessened and lessened over a period of time. So please remember, removal of fat or liposuction procedure is virtually scarless. But if we are considering tummy tuck or skin tightening procedure along with removal of fat, there can be a scar which is generally fine and well settled and doesn't look very bad. So how much fat can be removed in one go? So again, I'm stressing this point again. Do not look at this procedure as a weight loss procedure. If you're grossly overweight, suppose you are 120 kilos and your ideal weight is around say 70 to 75 kilos, then we are looking at around 40 kilos of extra weight. And then you should not look at body contouring procedure as a means to lose your weight. It is extremely important to understand that. If you are so much overweight and you have failed to inculcate dietary or dietary changes or lifestyle changes in your life, then it means you are staring at bariatric surgery, gastric bypass, or other bariatric procedures, which are actually weight loss methods or surgeries. So, if you are grossly overweight, then do not look at liposuction as a weight loss procedure. If you are grossly overweight and you are losing weight by bringing about positive change in your lifestyle, which includes good dietary habits and exercise, then we can contribute to your journey by doing liposuction and giving you that edge which you lack. So, to all my patients who are grossly overweight, I always ask them to make a genuine effort to bring about change in their lifestyle so that they lose significant weight by their own effort, and then we can jump in to give you right kind of shape. So if you are grossly overweight, then don't look at liposuction. Now if you were grossly overweight and you have lost weight and now struggling with some areas which you have failed to lose weight, generally these areas are lower abdomen, thighs, love handles or sides of the abdomen, on your chest, these areas you fail to lose weight even after diet and exercise. So we will help you greatly there. Sometimes in case of women, they have a lot of extra fat on their back, especially the bra rolls under the straps of their bras. Then they can have extra fat on their buttocks, particularly it's difficult to lose. So we can help you there. Or other problem which many of you experience after losing a lot of weight is laxity of skin or loose skin. Therein we can be extremely helpful. We can tighten your skin, the skin of abdomen, thighs, arms, all these areas can be tightened by body contouring procedures. So can you get body contouring procedure only for loose skin? Yes, you can get body contouring procedure for loose skin. So most of the times, when does this problem occur? There are two reasons. One, in case of men, it's mostly result of loss of a large amount of weight. We can we try to lose this weight, and then we regain so we once we lose weight, the skin fails to shrink. This particularly happens with the extra amount of weight, with extreme loss of weight. With the loss of this weight, your skin will be very loose, particularly in the arms, abdomen, and thighs. So in body contouring procedure, yes, we can do that. We can tighten the skin, and it will leave a fine line-like scars in that area. But yes, contouring can be done. In case of women, the loose skin generally result of post-pregnancy recovery, particularly lower abdominal or mid-abdominal skin, and also during recovery, when you are recovering from pregnancy, then you many times you fail to lose adequate weight. Therein we can help with the liposuction, and in case you have lost the extra weight and fluid which you gained during pregnancy, then you are left with loose skin in your arms and abdomen in particular. So along with that, many women lose a lot of volume in their breast post pregnancy and post lactation also. So in these cases, we label this procedure as mommy makeover, wherein we take out residual fat which is interfering with the good contour. We tighten the skin by removing extra loose skin and tightening it up. We can tighten skin of arms, and we can lift your breast also at the same time. We can enhance it also by injecting fat or by placing implants. So in case of women, when they are recovering from pregnancy and they have failed to regain their lost contour and shape, we can help in total changeover by targeting breast, abdomen, arms and thighs, buttocks also. So we can help you regain everything which has been lost. So when do you able to see the results? So it depends upon which procedure we are doing. Suppose we are doing enhancement. Enhancement means we are enhancing the breast, or we are giving you shape by injecting fat. Then that enhancement is visible right away. I mean, you come out of the procedure room and you will see that change. Now, if you are removing fat and giving you better contour by taking out fat from undesired areas, you will see some change right away, yes. Then in first week, there is significant swelling in that area, which may sometimes hide the improvements or the gains which you have made. So by end of 3 weeks, quite a lot of swelling settled, and by end of around 2 months, you get to see your new shape, and you'll be very happy by around 2 months, 2.5 months. So many of my female patients, they're asking, uh, what kind of surgical procedure is good for me post pregnancy? So if you are suffering from loose skin on your abdomen and uh, in arms, and you are experiencing laxity in your breast tissue, then yes, you need a surgical solution for that. We suggest you breast lift and tummy tuck. And these procedures help us remove fat, tighten your skin, and lift your breast. We can enhance your breast also by adding some fat there. Then another commonly asked question is whether this procedure is covered by health insurance. Mostly no. Most of the health insurance companies will not cover any cosmetic procedures. So these procedures are almost always have to be paid from your own pocket, and most of the insurance companies may not cover cosmetic surgery procedures. All body contouring procedures are seen as cosmetic procedures, but we can help you there by arranging interest-free EMIs. We check your eligibility for that, and most of the times we are able to help you there by providing you finance for that. So what exactly we do different? So I will stress on two things. Number one, we bring to you the immense experience, and plus not just experience of performing this procedure over the years and refining our techniques. It brings us special aesthetic insight also, wherein we can see that how to contour your body in the right way. We never try to take out too much, and we always believe in just doing the right kind of procedure. We don't try to push procedure on you. And further, we firmly believe that there's no single solution for everyone. It always has to be a combination of solutions, and our plans are customized, and they are planned for every individual person. Now, other thing which is extremely important is our entire approach. So we do not just believe in performing our procedure and walking away. We sincerely believe that each procedure should have an impact which is positive in your life, which brings about the change which you are expecting, which gives you more confidence, and it improves your self-image, and you feel good about your outcome. And it's also important that you maintain this look for years to come. So we help you that. We help you there by providing you continuous guidance on that. And so at Iconique, your results are long lasting, and we continue to be by your side for months. So that's all from Iconique today, and we hope to see you soon. And once again, stay safe, Continue to stay at home, follow all precautions, wash your hands, maintain social distance, and use masks. Thank you.